My name is Tushar Patel. I'm a plastic and reconstructive surgeon here at the Institute of Advanced Reconstruction. I see patients in our Edison, East Brunswick, and Shrewsbury offices in New Jersey. Graves' disease is a thyroid disease where it's an autoimmune disease where your thyroid gland is very hyperfunctional, so it's very active. The symptoms are you feel palpitations and anxiety and agitation, and you're very hot and you lose weight. Those types. It's a very systemic disease. People that are diagnosed with Graves' disease, about 20% or 25% have eye pathology. And what we usually see in those patients is the eyeball pushes out. It kind of pops out. So they look like they're like really, bulging eyes and staring at. Graves' ophthalmopathy can be treated multiple ways. There can be medical management. There are medications that can be used for mild forms of Graves' ophthalmopathy that reduces the bulging of the eyes. There are other things which aren't used as much, but are still available, like radiation and things like that. But those have some other side effects that are not too favorable. And then there are also surgical orbital decompression, what we provide here at the Institute for Advanced Reconstruction. The way we determine if they're a surgical candidate is if they tried some medical management with medications or radiation in the past and it wasn't enough. If they have really bulging eyes, which we measure, we have a measurer called an exophthalmometer, which measures the amount of bulging that the eye is doing. Orbital decompressive surgery involves essentially making room so the orbit or the eyeball can sit back into the socket. Orbital decompression typically takes 2 hours to do, sometimes an hour and a half, sometimes 2.5 hours, but on average about 2 hours. At the hospital, you're asleep, general anesthesia, so you don't feel anything. You'll stay overnight, and the next morning you will be sent home. Walking around is fine, going up and down stairs is fine, just nothing strenuous, nothing that's gonna increase the blood flow to your face. And I tell everyone that the process of the eyeball going back in takes a long time. Every month gets better, but it can take anywhere to a year to almost a year and a half until we get the final product was right where we want it.